The World Health Organization's definition of health is not merely the absence of disease or injury, but it's the state of being, of physical, emotional, and social well-being. And so a lot of our time is spent trying to map out systems to ensure that these conditions are nurturing and healthy for folks.
Our goal is to improve the health of the communities, and that means what's happening within the walls of Cambridge Health Alliance as well as what's happening outside of those walls. So in order for us to improve the health of the community, we think about substance use disorder, we think about mental health, we think about access to those types of services and how that impacts the economic well-being of people now and in the future.
80 to 90% of your health is what happens on the outside in your community. It's whether you have a job or not, or whether you have 3 jobs and it's hard to cook healthy and have time with your family. The Community Health Improvement Team has a very extensive process working hand in glove with the cities, all our legislators, all the not-for-profit agencies, all community activists. And every 3 years, just about, we identify all of the health needs. We do extensive surveys with all folks.
We literally just completed our second community health assessment, which we just released a few weeks ago. And our 3 priority areas for the next 5 years have to do with healthy eating and active living, community and social resilience, and an emphasis on mental health because of the feedback that we've gotten from residents. All this really with a lens in addressing health inequities here in the city.
And then we've actually brought resources on site. So we have a food market at our Revere site. That's a partnership with Greater Boston Food Bank, where on a monthly basis, Greater Boston Food Bank brings fresh fruits and vegetables, which is a type of food that we know is both healthy and really hard for patients who are living on the edge to access.
People in our communities, they work really hard. And sometimes they don't have time to go to the doctor. Sometimes they don't understand how the health system works. So every year we go out there and we recruit and train about 25 to 30 individuals that will help us with our community work. They not only help us understand what the community needs are, but they are partners. Having people that work with us and understand the system, go back in the community and spread that information is vital to everything we do. We need our volunteers not only to help us establishing that connection, but also help us deliver the message in the language that that community is speaking.
And when we work as a coalition, we are able to leverage the diverse expertise and life experiences of the patients who live in our communities. We think it's one of the most valuable ways that we can address the issues that are really entrenched in our communities, like housing insecurity and food insecurity.
Population health is the mainstay of care of the Cambridge Health Alliance. Historically, we cared for patients when they are sick. With population health, we care for patients when they're healthy. And we look at the patient's goals and objective in partnership with the patient. The outcomes that we hope for are reduced health disparities, improved health outcomes, and our goal is seamless patient-centered system of care. This process reliably and consistently has been proven to provide health to our communities and better care to the patients at their environment without the need of them seeking care only when they're sick.
Many of us come to work at CHA because of that mission. To us, that's more important than anything else we could do. And for us to have the privilege of working with our patients and showing that compassionate care is as good as it gets.